It's great to be here in Seminole County and with Orlando Health. I want to thank David Strong for hosting us here, and also thanks for all the great work that the folks at Orlando Health have done across all their hospitals over these many months. Also want to recognize Senator Jason Broder, who's here. Congratulations on a great win, and also State Representative Scott Plakin. Scott, thank you so much for all your hard work. We're here today to announce the kickoff of Orlando Health's community vaccination sites. In addition to right here at the South Seminole Hospital, Orlando Health will be operating community vaccination sites at 6 other locations: Orlando Health Dr. Phillips, Orlando Health Winnie Palmer, Orlando Health the Central Hospital, Orlando Health South Lake, Orlando Health St. Cloud, and then Bayfront Health in St. Petersburg. And I was talking with David and some of the physicians. They've already, just at this site, right, have done 1,500 shots today, and they think that they can get to, what, 4,000 shots for the day. So that's really going to start. I mean, I think they're going to be in a great groove. We have given them an allotment. They think they're going to blow through that. And we're going to give them more because we want the shots to go in the arms. So as with the case with vaccinations in the state of Florida, the vaccines will be reserved for individuals 65 years of age or older, frontline healthcare workers, staff, and residents of long-term care facilities, as well as individuals that the hospitals deem to be especially vulnerable to COVID-19. When the vaccines first came, they were earmarked primarily for staff and residents of long-term care facilities and for frontline healthcare workers. And so Orlando Health was one of the first hospitals to have Pfizer vaccine. They were able to do a lot of their staff. Many other of those initial hospitals did as well. Most hospitals in Florida did not get the Moderna until right before Christmas. I think they've made a lot of headway with their staff. They're probably still in the process of doing some of that. So obviously those are important priorities, but I think what we want to be clear going forward as it relates to the general public, we really believe it's important to put our seniors first. And that's what we're going to be doing. You're going to be seeing that in places like this where we were able to, in the area where they're doing it. And I think you're going to see that all across the state. Now, Orlando Health, their goal is to administer at least 10,000 vaccines a week. It seems like that they're probably going to hit that and then some. And to receive a vaccine at one of Orlando Health's locations, you just have to visit vaccine.orlandohealth.com and register online. Now, of course, supply is still limited, so we ask you that you bear with us, both the health systems as well as other folks who are doing it. They're working really hard. This is a big priority for them. They do a great job, and they're going to be administering vaccines as quickly as can. The hospital-led vaccination efforts will be critical to the rapid dispensation of vaccines throughout the state. And in fact, up to this point, about 80% of the vaccine doses have been distributed to hospitals around the state. And some are doing really well with that, and we want to thank them for what they'll do. And what we've done is we've asked all the hospitals who are getting vaccine to submit to us how they plan to offer vaccinations to the community, especially, of course, our senior citizens. And I want to be very clear on one important point. Hospitals that do not do a good job of getting the vaccine out will have their allocations transferred to hospitals that are doing a good job in getting the vaccine out. We do not want vaccine to just be idle at some hospital system. So as David and everyone here at Orlando Health, if they're exceeding their targets, which they very well may be based on what they're doing today, and there's other hospitals that are not moving the vaccine, then we're going to up their allotment, and we're going to reduce the allotment of any hospital systems that aren't getting the shots in the arms. And so we really view the hospitals as the front line on this. They have the infrastructure, they have the expertise, and they have the relationships in the communities to really do a good job. At the same time, what the hospitals can do is necessary, but it's not completely sufficient. And to that end, I have 4 new announcements about how the state of Florida is going to continue our aggressive approach to increase vaccinations. So first, I've directed the Division of Emergency Management to work with the Florida Department of Health to identify state-run COVID-19 testing sites that can be converted into vaccine sites. So these are sites that are generally pretty large, have a lot of parking capacity, have drive-through capacity, and we've shipped a lot of vaccine to long-term care facilities, all the major hospitals in the state, county health departments. We need to add additional layers to the vaccination strategy. We believe we'll have enough doses to be able to do that. And while we may not be able to open all the sites we want to right at the start based on supply, we do think that there's going to be enough supply to establish some additional locations. So we're going to have more announcements on that this week. And basically what we're trying to do is figure out any way to get this into the community so folks have access to it. The second announcement is that the state of Florida will be identifying places of worship in underserved communities where we can administer the vaccine. So we already piloted the idea at a church in Escambia County up in Northwest Florida, and it was a great success. We were able to vaccinate over 500 seniors and also have them scheduled for their booster shot, which they will then receive at the same location when that time comes. So you're going to see this approach all over the state, and we'll be making more announcements on that very shortly. Third, I've directed the Division of Emergency Management to activate existing contracts for 1,000 additional nurses to support vaccination efforts, and we're going to deploy them throughout the state to help vaccination sites, public sites that the state may run. We may even help if a hospital is shorthanded. Basically, however they can help facilitate shots getting in people's arms, we want those nurses to be able to do that. And of course, these personnel supplement the more than 800 National Guardsmen who've been mobilized in this effort from the very beginning, and were instrumental in our strike teams vaccinating seniors at over 100 skilled nursing facilities in the first 6 days of receipt of the Pfizer vaccine back in the middle of December. And fourth and finally, I'm directing the State Emergency Response Team to assume additional responsibilities regarding administering vaccines in Florida's nearly 4,000 long-term care facilities. So currently, the vaccination of residents and staff in long-term care facilities, including assisted living facilities, are being handled by CVS and Walgreens pursuant to an agreement they have with the federal government. But we want to accelerate that pace. We believe vaccinations, the sooner the better, and so there's no time to waste. So you're going to see more state effort, additional state effort than what we've already done, which has been significant in those facilities. And I just want to be clear on one thing. We don't believe it's time to rest. So any state site, if we do a drive-through site, if we do a pod somewhere in a community, I've ordered that anything the state of Florida is doing is open 7 days a week. So if you have a drive-through site down in Miami, we want that open 7 days a week. And I've also asked the hospitals to consider expanding their services to 7 days a week. I just think it's going to be easier for people. It'll be more opportunity for people to be able to get in and get vaccinated. And we really view, particularly, these next 2 months as really crunch time. So anything the state's doing, it's going to be 7 days a week. Now, the opening of hospital vaccination sites, along with these 4 new actions, are a timely complement to our first 3 weeks of vaccinations, where we were able to see a lot of great things. Florida was the first state in the nation to begin offering vaccines to staff and residents of our over 4,000 long-term care facilities. We're also the first state in the nation to begin offering vaccines to EMTs and paramedics. And most importantly, we were the first state in the nation to mobilize our county health departments and county emergency managers to begin actively vaccinating seniors in our communities. In the first week, which when we got vaccine in the middle of December, we only had a handful of hospitals that was given it. Orlando Health was able to be one of those, and they started using it. They were focusing mainly on their staff, particularly people that are in contact with COVID patients, doctors and nurses, and they've had a really good response here. I asked them what percentage of people are doing it, because you hear stories around the country of, most of the nurses don't want it or whatever. Well, here at Orlando Health, they said at least 90% of physicians have taken the vaccine, and about 75% of their nurses have taken the vaccine. So I think those are numbers that are higher than what's being reported in some other parts of the country. Of course, in the first week, once we had word that CVS and Walgreens would not begin vaccinating until another week after the initial doses were received, I directed the Florida Department of Health, Division of Emergency Management, and Florida National Guard to mobilize EMS strike teams to immediately begin offering vaccines to staff and residents of long-term care facilities. We didn't want a week delay, and so they were able to do in just 6 days' time over 100 facilities in 2 heavily senior-dominated counties, Pinellas and Broward, and I think that was really, really good. And now you're going to start seeing all those seniors that first week who got the Pfizer, they're going to be getting their booster shots very soon. And so we're going to continue to focus on that mission. Now, just before Christmas, the state received the first shipment of the Moderna vaccine, which was directed to over 170 hospitals that span the entire state. So most hospitals in Florida received Moderna right before Christmas, and I know they were working on doing their staff. Now, Christmas, New Year's is not the best time to be able to reach all your staff. That's just the way it goes. So they've worked really hard, and we appreciate it, and we understand that the timing, if it was early October, would have been a little bit different. But I think that they've worked really, really hard. We also, during that week, I signed the executive order to prioritize our senior citizens. Now, CDC's initial recommendations in their advisory committee was to not even include seniors at all. They were going to have essential workers, which obviously would not have been the best approach to reduce mortality. There was a lot of blowback about that, and so then they said, okay, do essential workers and then 75 and plus. In Florida, we don't believe that's the best approach for our state. We believe we've got to focus on senior citizens, and so here the seniors are the priority. We don't want a situation where someone's 20 years old working at a grocery store, which is an honorable thing and great, but that person get priority over a 74-year-old or a 73-year-old grandmother. No, we've got to focus on seniors and put our seniors first. And then this most recent week, we were able to send vaccine to every county health department and nearly every hospital in the state. So the vaccine is now available statewide. This was also the week when county health departments began working with local partners to offer vaccines in the community. So right before New Year's, I had the privilege to go down to a senior community called Kings Point down in Palm Beach County, and working with the Palm Beach County Health Department, they were able to administer hundreds of vaccines to residents of the community, all of whom were age 65 or older. It was a good event, and this is the type of thing that we're going to continue to replicate in other senior living communities across the state. Now, as we enter the new year, I think there's a lot of reason for optimism. I mean, I've talked about some of the statistics that you hear what's going on today. I think you're going to see that at hospitals throughout the state. They have all the staff back, everyone's ready, and we're going to really hopefully see a lot of shots going. So I think that we want to continue to see this vaccine administered as quickly as possible. We want to continue to get more and more supplies. But just in a couple weeks' time, you went from only being able to send it to a small amount of hospitals to now having it available across the state with hospitals. And then, as I mentioned, we're going to be doing some stuff with the test sites. I'm also going to have a number of announcements this week about other innovative ways to get this into the community. So 2020, not the best year that I think any of us have had. It was really, really tough for a lot of people. No matter whether you ever had any encounter with COVID, it was still tough for people. And I think 2021 is going to be brighter. And I think this vaccine is providing a lot of hope to a lot of people. So I want to thank the folks here at Orlando Health for really being the tip of the spear. It was great to just peek into the room and see all these folks that are there in line going to get the vaccine, and we're going to continue the momentum going forward. So I'd like to invite up David Strong to say a few things.
Well, thank you, Governor. I want to thank you for your leadership and your continued presence, actually, throughout the entire pandemic. It's been important. I want to introduce the folks that are standing here with me. First of all, Dr. Jamel Hakeem. Dr. Hakeem's the Chief Operating Officer of Orlando Health, as well as a practicing anesthesiologist. And to my right is Dr. George Rawls. He's the Chief Medical Officer of Orlando Health and a practicing ED doctor. And so both of them in their practices interact with patients both who have have COVID as well as have received the vaccine. I want to start off by just thanking the Orlando Health team members. Many of the folks that are involved in planning and administering the vaccine are the same individuals that have been caring for patients across this system, whether they're COVID-19 patients or other patients that need care. And so the individuals that really carry the weight every day are continuing to do that. And so it is with sincere appreciation and thanks for our team members and our physicians for their continued amazing work throughout this year and what they will do going forward. Also, just a quick comment on our process for the vaccine. It has been a very purposeful process. As you heard, we started off initially with frontline staff, both from a physician standpoint as well as a clinical standpoint, that take care of patients that potentially or are COVID positive. We've administered about 10,000 vaccines to that population. As you've heard this week, we anticipate that we will have another 20,000 vaccines administered. That focus is on a few different areas. First of all, we are focused on opening up to any healthcare worker or frontline individual, first responder, that's not employed by Orlando Health. And so if there are any, whether it's a dental office or other physician offices, if they want to receive the vaccine, they can go online and book an appointment to do that. Another area that we're focused on is nursing home and long-term care facilities, as well as assisted living facilities that have not been served yet by the other individuals that are administering the vaccine. We want to be able to help them. And then another area that we have focused on is really our team members, family members that are over 65. And that is a purposeful place for us to focus. One, it's people that we know. Two, as you may have heard, as you've read, one of the greatest weights that frontline caregivers carry is, are they going to give COVID-19 to their families? What impact is that? And so it is a purposeful approach for us to focus on our team members and their loved ones. Next week, the week of January 11th, we will transition from those areas that I talked about to going outside of the hospital. We will open up 6 clinic locations. A few of those will be drive-through, but trying to make that more accessible than trying to come on a hospital campus. And so it will be more of a clinic environment with even an easier scheduling process. I'm going to turn it now over to Dr. Rawls. Dr. Rawls will give a little more detail on the process that we've gone through, but also talk about any of the clinical implications that we've seen from providing the vaccine. George.
Thank you, David and Governor. So we've had a very positive experience so far with our vaccine program. We started the program on December 18th. As David mentioned, it was focused on our frontline healthcare workers, and we included all of the team members that were part of our surge plan that would have been drawn into patient care activities had the situation gotten to the point that we needed them. And that worked really well. We got thousands of people through in 4 days. To this point, we have about 10,000 people that were part of that group that were vaccinated that are now coming back in for their second dose of the Pfizer vaccine this week. As we saw more inventory come in, the Moderna vaccine was in our hands. We were able to expand our vaccination program to a broader group of community health providers, to EMS and fire personnel that didn't have access to it some other way. And now we're into this sort of third phase where we have a sufficient supply to really expand the program out to include those over 65 and over that we can reach out to by way of our team member network. So our goal this week is to get through the 20,000 doses that we had set out, and then continue to work towards a new phase of this come the week of January 11th, where probably the easiest way to describe it is we want to normalize the vaccine process into the regular process of getting your health care, where it's not a special thing you have to do, go to a special site. We want to make this available, something that's very easy to access, and make sure that as the inventory grows, the options grow for us, that we have the ability to make that just, again, easier and more accessible for our patients and for the entire community. So that's our work this week, and we really are hoping to be able to maintain that high volume of vaccination opportunities for the community well into the next few months. As David mentioned, we've had a good response in terms of our team members' interest in this. It's much higher than you've been reading. We've had nearly all of our physicians want it. We've had the majority of our healthcare teams want to get the vaccine, and they've been vaccinated. And probably most importantly, we haven't seen adverse reactions to the point that it's of any way concerning to us. We've had very, very few people report anything. We haven't had team members out of work because they got a vaccine and felt sick. Obviously, there's more to follow. We have a second dose coming up, and we're going to track that very, very carefully. But the reason why I mention that is that's one of the things that holds people back. Is like, what if I get a vaccine and then I can't go to work? You know, at the end of the day, it's possible, but we haven't seen that. And I would just like to reassure those that or have that in mind as a reason not to get it now, that our experience on the ground has been very positive on that front. So again, we're looking forward to continuing the strong partnership with the governor's office, with our local public health officials, and make sure that we are able to do for the community what we can do to make sure vaccine is not held on a shelf somewhere, that we're doing, as the governor said, get the shots in people's arms.
Well, thanks again. I think that you guys have really worked hard. We really appreciate all that you've done. And just to remind folks, when you have that vaccine in any of the hospitals, we want you to use the vaccine. If you're not using it, then we're going to make sure that additional allotments are going to be reduced and then expanded in places where they're really making good use of it. So. You know, it's not the easiest thing. We understand that, but this is really, really important. So I thank all the folks throughout the state who've worked really, really hard to be at this point. And I'm just optimistic that seeing what's going on here. I mean, I knew they would be doing good, but the numbers that they're talking about today, I mean, it's higher than I anticipated. And so that's what we want to keep seeing. We want people to be able to get the shots. And that's going to be a good thing for a lot of folks throughout the state. And speaking of shots, I think we have a demonstration. So I think we're going to have a variety of people. I know we have, there we go. So we got, and then you have patients. Okay, great. So we have first responders. How many total are we doing? Five. So you have 2 first responders, a nurse,
And 2 over 65.
and 2 elderly.
Yeah.
Okay, so 5 shots, first responders, I think 1 healthcare worker, and then 2 65 and over. Take it away. Now so they're at this point, just can you explain, they have to sign a form, the emergency use authorization, you give them kind of the rundown on that, and then obviously it's their decision whether they want to get the shot or not.
They'll consent to it, and they'll be given a card to use and come back for the second dose as well.
Okay, so you guys already have your card for the second dose.
We did.
And is this Moderna or Pfizer?
This is the Moderna.
Moderna. So Moderna would be basically almost a month, 28 days. So if they're getting it in early January, they're going to be back probably sometime in early February, and that's great. Take it away.
Since I'm sitting here, you can go left.
Oh.
I'll make it easy.
Thank you.
Chief been working out because it was honored.
And you guys both work Longwood Fire?
Yes, sir.
I didn't see you over there. How's it going? Good to see you.
Ready?
I'm ready.
You ready?
Well, that was nothing. All right. Thank you very much.
All right.
Great job.
Thank you, Chief. All right. And what's your name?
Judy Wright.
And you live here?
I do, yes. And I'm work at San Lando United Methodist Church, just down the
Oh,
street.
wonderful.
And our pastor, Jonathan Carmen, made me come today. He's worried about me, so here I am.
Good.
And my
Well,
husband.
seems like it's going to go well. We've had a lot of good success, sir.
Thank you.
Good job. Thank you.
Oh.
Barely.
guys.
JB Buno here with you live on WFLA Now. This is live from Orlando, where Governor DeSantis has announced the next steps in the vaccination process statewide here in Florida. I believe that Governor DeSantis will be taking questions here momentarily. In the meantime, 5 individuals, including you see here 2 seniors over the age of 65, are receiving the vaccine.
All right.
Thank you for the opportunity.
Coming up
That's it, right?
after the press conference, we'll be answering some of your questions here in the Facebook Live comment section.
Good and golden.
All right. Well, thanks for coming, guys. You have a happy New Year. You too. All right, we got one more. And what's your name? You live in Seminole County?
Yes, I do.
Great. And you have an appointment to come back in when, early February? Good. Oh, okay, good. And you have a child, a son or daughter that works here?
My daughter-in-law.
Oh, daughter-in-law? Okay. Great.
Absolutely.
Regular freezer, like when you take it out, how long can it be out of the freezer?
Just hold that right there. Perfect. Thank you. You're welcome. Good.
How was it? No problem?
I didn't feel it.
There, great, see?
You're
All right.
welcome.
Good job. Have a happy New Year.
Happy New Year
Yeah,
to you.
absolutely. Well, there you go. And I got to say, we've been now doing these for a few weeks. We've been doing the demonstrations, and there's never been a hitch in the giddy up. No problem with anything. It's just, you know, it's a needle. Some people don't like them, but it's not been any issue. Everyone's been fine with it, and so we want to thank you guys for doing it. I know you're going to do a lot more today, so we appreciate it. With that, we'll take a couple. Yes, sir.
So, Governor, I just want to ask about you've heard about the nationwide, in some cases, criticism of the rollout. I'm talking nationwide, but you seem to be very in tune with that. You talk about kind of ramping up things here in Florida. You said the time is now. You said hospitals. You have gotten 80% of the doses from the state to the hospital. Do we know, are the hospitals pushing them out quickly enough? You said you would take them away from the hospitals if they don't.
So we're that's going to be evaluated now. I said 2 weeks ago, I said, look, there's going to be a decline Christmas and Christmas Eve and Christmas, and there's going to be a decline New Year's Eve. And that happened. I mean, that's just the reality of the situation. You know, Israel has done, in the U.S., I think we're 3rd per capita in doses administered in the world right now. Israel's #1 with the bullet. I can tell you, if Israel got those doses 2 days before Passover, they wouldn't have gotten as many. That's just the reality. So I think a lot of the criticism nationwide is kind of unfair. There just wasn't the doses in hand until really right before Christmas. Only Orlando Health and a handful of other hospitals had the Pfizer that first week. Almost nobody else did. And so I think what we've tried to do in Florida is say, you know, we trust obviously our healthcare delivery system. I mean, that is who's going to do the best at this, and we're going to constantly evaluate. The fact that they're on target to do 4,000, guess what? I'm going to Jackson Memorial in Miami today. I'm going to tell Carlos, the CEO, Carlos, they're doing you better be doing that. You cannot beat them. So I think we want to see a healthy competition of where we're getting this out in the community and doing it in a really good way. And I think also what Florida, I think, has done is when we saw a gap with long-term care the first week, we filled it. Over 100 facilities right off the bat. When we see some gaps in other parts, we're going to fill it. We're going to be at, we were at an African American church in Pensacola. We're going to be at some other places. We're going to do drive-through sites. And so a lot of this is just contingent on getting the doses Now that this, we're going to have more in the county health departments, we're going to have more in the state, it gives us more ability to do some of these things. We're going to have some good announcements tomorrow. We're going to be partnering with the private sector. So I think that it's the new year. Everyone's now back. Christmas, New Year's, it is what it is. The hospitals are not fully staffed like they would want to be. I mean, that's just the nature of it. Now we're in a situation where I think what they're doing at Orlando Health is a great model. I think other hospitals are going to be doing it. And I think you're going to see those numbers, not just in Florida, but nationwide, really jump. But I think it's important to point out, Florida's approach, I think, is the better approach. If you have a 73-year-old parent, 73-year-old grandparent, in the vast majority of states in this country, they are simply not eligible to be vaccinated. And we don't believe that's right. We believe the seniors have to be put first. Obviously, they've done healthcare workers, and they'll continue to do that, and they should. Obviously, we're doing staff of long-term care as well as those seniors there. But our senior population deserves to be the priority. We were the first to come out of the gate on that. We've had Texas, and I think Louisiana, Georgia, Colorado has followed suit. But I can tell you, that's the way to go. And we're going to continue to build capacity as we get more doses in. So I'm optimistic.
Governor, you initially started vaccine distribution with healthcare workers, and now it's expanding to those 65 and older. Are you considering adding teachers to that list?
Not at this time. I mean, any teacher that's 65 or older or who meets other criteria. I mean, for example, the hospitals have the ability to vaccinate somebody regardless of age if they're especially vulnerable to COVID. But basically, this is for us, this is based on data. And if you look at the COVID mortality, 65 and up represents over 80% of the COVID-related mortality in our country and in our state of Florida. So that's where we got to focus on the outset. We were talking before we came in with some of the docs. The Johnson & Johnson vaccine, we think we're going to get data on that very soon. They could file for emergency use authorization potentially this month, but certainly I would think by the beginning of February. That's approved. You're then looking maybe sometime in February to have a one-dose vaccine. And we'll see what the efficacy is, but I'm hearing it's pretty good. One-dose vaccine produced to scale, that is where I think you can get in easier to folks who are in the workforce. But the fact is, just based on the data, the average person under 65 in our workforce has been at less risk than our senior population to COVID. So we're going where the risk is greatest. We're going where we can have the most impact on saving lives.
Governor, what's the next subgroup going to be? Do you know when shots are coming in, how many for next week and the following weeks? Because it sounds like you're really gearing up your troops, but...
So we get the final report, I mean, usually maybe 3 days before it ships. Now that Moderna and Pfizer both have EUA, it's a little bit more predictable, I think. So we basically get an allotment, and then we determine kind of how to do it. So for example, Orlando Health, if they do 20,000, and Dave said, we could probably do 30,000 next week, then maybe we do that. And if someone else has been given a lot and hasn't gone through it, maybe we dial that back. So, but we usually know the week before the precise amounts. But I do think it's going to get pretty predictable, and I think that'll be really good for everybody to kind of have a good sense of where we're going. And all in all, the fact that we've gotten it when we've gotten it, it hasn't been perfect, but man, this is a big logistical operation. I give the federal government a lot of credit. I mean, I think there's so many things that could have gone so wrong, and by and large, when issues have come up, you've been able to troubleshoot them.
During Christmas, Governor, during Christmas and New Year, we reported have a lot of cases, a lot of people going out and partying. What the expert says that it will increase the numbers of people getting positive results. What do you think?
Well, look, I mean, what I would say is, we trust people to make decisions. I mean, I think that, this idea of browbeating everybody, I just don't think it's been effective nationwide. I mean, you look around the country, you will literally have an elected official stand at the podium, wag their finger, say, you do not travel over the holidays, and then literally, right when the press conference goes over, that same person is driving to the airport. You have somebody who's saying we can't open schools because it's too dangerous, and then they're caught on a beach somewhere in Puerto Rico. So I think we just need to say, use common sense. But I think we have to be, I think we have to recognize some of the misfires that some of the information and the advisory from particularly experts have had. I mean, they've had some very contradictory advice over these many months, and I think some people have lost faith. And I worry about that, not as much for behavior, but more for confidence in the vaccine. If you have experts saying the vaccine is good, which I think the data is strong on it, we want people to take it. We're not going to force anyone, but we want them. Are people going to be willing to say, you know what, I trust that? And I just think there's been so many problems with some of the stuff that we've seen. So just people just use common sense, it's particularly if you're in an elderly population. Look, the light's at the end of the tunnel now. People are getting vaccinated today, tomorrow. I can't guarantee you, obviously, every senior is going to be able to get vaccinated tomorrow or the next day. But I can guarantee you, as long as we keep getting in, that's going to be the priority, and we want to get it done as soon as possible.
Governor, do you fix the residency issue? Because for a while it was like different counties were saying residents only. I mean, it's a federal vaccine. It's coming from the federal government. If you live in one county but there's space in another county, do you have an issue with people going from county to county?
So we have not imposed that requirement on anybody. I think that some health systems have also said we're going to focus on our area. I mean, my view is when we do something like a drive-through test site, I mean, for example, you know, if there's one in Orlando, and I'm not saying we haven't announced that yet, but if there is one, I'm not going to say it's only for Orange County. I mean, Lake County, whoever in the area, we want to get shots in arms. And so I think the important thing is to get the shots in the arms. Now, there obviously has to be some structure to it. Otherwise, it's not going to be as effective. But at the same time, I do not want to see a vaccine sitting around, not being used, when you could be putting a shot in an arm.
Governor, do you know what that next group or subgroup is going to be and what the timing is on administering? And could that include teachers?
Oh yeah, no, I think almost assuredly we would probably go to the workforce next. And I think the Johnson & Johnson vaccine is a great way to do that. I mean, you literally could drop a bunch of vaccine at Disney, Orange County schools, wherever, and they can knock that out pretty quickly, and it's one dose and done. So I think that makes more sense with essential workers. I mean, apart from the different risks between elderly and essential workers. And look, I've criticized essential. I mean, obviously, I think things like teachers are very important, all this stuff. But I view people that are earning a living and putting food on the table as essential, because it's essential to their family. And so we want to make it as widely available to the workforce. I think the reason why like a teacher's would be great is because you have them all at the school. I think you can knock it out very quickly. So from an efficiency standpoint, I think it would be great. We have obviously other major employers in Florida where I think they would be able to knock it out very, very quickly. So that's coming. I think it's dependent on the numbers of seniors. I mean, we have 4.4 million seniors in Florida. And I said, obviously, we don't have enough vaccine at the outset. People need to be patient and understand that, and I think they do. But we don't know for sure what percentage of those over 65 are going to opt for the vaccine. I think many will. I think the majority will. But, you know, we've gone to some of the long-term care facilities, and some have been 90%, some have been 50%. Some have just said that they didn't want to do it, and that's fine. There's not going to be any type of forcing. But as we get through, and then we see how demand goes, you know, we obviously, if there's vaccine available and the senior demand goes down, it's not going to happen anytime soon, but maybe weeks in advance, months, then all of a sudden you're looking at, okay, well, let's get it out there to folks. So we're doing it, but I really think that the key to this for really doing well in the workforce is this Johnson & Johnson, the one dose. It makes it so much easier when you're talking about workforce to be able to get that done. So that's going to be our hope. I would just say, monitor this. We're going to get news on Johnson & Johnson very soon. And I think it's going to be good news, and I think that will give us another arrow in the quiver, you know, as we continue to do this vaccination march. Thanks, everybody. We'll be back soon.
Can we ask Dr. Rose a question, please?
Streaming live on WFLA Now, powered by 1-800-ASK-GARY. Here's J.B. Buno.
And that was Governor Ron DeSantis here in Orlando, here in Central Florida, announcing the next vaccination steps here in the Sunshine State. Live to discuss it and answer some of your questions here with you live on WFLA Now. For those of you joining us for the entirety of the press conference, great to see you. You can use hashtag HeyJB to ask your question here in the Facebook Live comment section. We'll try to answer as many questions as you can, but really quickly, a recap of some of the big things that Governor DeSantis announced. He warned hospitals, making sure that he wants them to use their vaccine doses. And if vaccines aren't used by a particular hospital in a timely fashion, he is vowing a reallocation of those doses to hospitals that will in essence, use them in a more timely fashion. He also talked about converting testing sites to vaccination sites across the state. Not all of them, but of course some of them, and the state's going to be identifying the most suitable ones here in the weeks ahead. Teachers are not being considered sort of next up for the vaccine after the 65 and older crowd. A reporter asked that in the Q&A that you just heard there after the press conference concluded. And he said, not at this time. We're going to go where the risk is highest. So teachers aren't going to be receiving any special treatment unless they're, of course, 65 or older. More nurses are coming to the state. There's a heavy priority on long-term care facilities and places of worship in underserved communities. Some of them are going to be converted into vaccination sites in the weeks or months ahead. So try to answer some of the questions that you have here in the Facebook Live comment section. Use hashtag AJB, and I'll try to answer as many questions as I can. We have a couple of questions here coming in, and let's get to a few of these because I want to make perfectly clear to our audience that I am not a healthcare physician. I am not a healthcare expert. So to Melody's comment here, hashtag AJB, what about us with allergies, heart problems, 65 and older? Can they get this shot? As I understand it, it's of course that allergies does not preclude you from getting the coronavirus vaccine. Heart issues also should not preclude you from getting the coronavirus vaccine. But I am not a healthcare expert, and I'm letting you know that this is all based on what your primary care physician says. Anybody that has an underlying health condition that they're concerned about, contact your doctor, contact your primary care physician. It doesn't require you going into a doctor's office and asking that question in person. You can do a lot of this over the phone. Teledoc apps are also great for this, to ask a healthcare professional their advice on whether or not you are eligible and whether or not it is safe for you to receive a particular COVID-19 vaccine. Deb Norris here also, when will the persons with underlying health issues be able to get vaccinated with comorbidities? That will be addressed here in the future. Governor DeSantis noting there at the end of the press conference that the essential workforce is going to be next, or at least that's what he foresees after the 65 and older crowd is sort of dealt with first, of course, and also those on the front lines, healthcare workers and first responders, those who have been battling the coronavirus pandemic now for many, many months. So it looks like the essential workforce will be next. Again, to Kathy Bunker Gochius, hopefully I'm pronouncing that right there, Kathy. Which one of the vaccines are used for people with allergies? I'm not a healthcare expert. I can't speak to the particular vaccines. Moderna, Pfizer, the Johnson & Johnson one that you heard Governor DeSantis alluding to a little bit there at the end of the press conference. I can't speak for a lot of reasons. I am not qualified to speak on vaccinations and their correlationship with allergies. But again, I encourage you to contact your primary care physician. Let's see here. Evan Sad, hashtag AJB, did he say when high risk under the age of 65 will be able to get the vaccine? He did not. That, at least from what I heard, I was feverishly writing down notes or typing in notes as the governor was speaking. There was not a specific plan that I heard of where those that are higher risk under the age of 65 will be able to get the vaccine. You would hope that is part of the plan going forward. Makes no sense for somebody who is high risk and in need to receive it after somebody who isn't high risk and in need just because they're in an essential workplace. So we'll listen very, very closely to how Governor DeSantis prioritizes those who receive the vaccine here in the weeks and months ahead. As a reminder, getting to all the 65 and older crowd, we have a lot of folks here in the state of Florida that are 65 and older. It's going to take a long time, especially with the influx of people that we get here 65 and older, we get a lot of snowbirds this time of year. People coming from the Northeast, people coming from the Midwest, people coming to the state of Florida to get out of the harsh winter in those respective states, in those respective areas of the country. So it might take a while for us to get through the 65 and older crowd, or at least up to a point where we can start to administer the vaccine to those beneath the age of 65. So this could be an extended process here, folks. Hopefully the vaccine shipments continue to roll into hospitals. Hopefully that we have a fluid situation, pun not intended, a fluid situation at getting signups handled correctly and people able to schedule their appointments and get in and out for multiple doses of the vaccine. Remember, Moderna and Pfizer, you have to get those 2 shots, so it's not as simple as just one simple visit. We'll talk about Hillsborough and some of the problems that they had today here in a little bit, but hopefully that answers your question here, Evan. Let's really quickly, for those of you just joining us, I'll try to get to a couple more questions here in a moment. I want to get to our poll results. We did ask you in a WFLA Now Facebook Live poll to grade Governor DeSantis' handling of the COVID-19 pandemic here in Florida, and you either are very much in his corner or you're very much against some of the policies or the actions or inactions of Governor DeSantis since the pandemic began here in Florida. 35% of you giving him an A, 53% of you giving him an F, only 6 and 7% a B or a C. You're pretty much very much in favor of what Governor DeSantis has done here in the state of Florida, or you're very much against it clearly here based on these poll results. I'll get to a couple more comments here in the Facebook Live comment section. Again, I'm not a healthcare professional. I cannot answer questions related to your particular allergy, your particular comorbidity. All of these particular healthcare issues should be taken up with your primary care physician. And again, you don't have to go into a doctor's office to have a simple question about your medical history answered. Just make a phone call. I don't have an exact number, and it's impossible really to say for sure, but Carolina here, how many lots of vaccinations are available to Florida. The vaccination doses, the shipments are being administered across the state. We've heard reports of them pretty much being received in almost every corner of the state of Florida, but to know exactly how many are available at a given time is really hard to say. But we're talking about, I can tell you one number I can share with you, and this is a couple of days old now. It was when I left here on Friday, we were up to 211,000 vaccinations that were completed, as in people that had been vaccinated in Florida. That's 1% of the population here in Florida. And I would imagine that over the weekend and into today, that number is going to grow significantly as more and more hospitals continue to administer the vaccine. Again, if you want me to answer your question or just feature your comment, maybe have some feedback on what you think of the job that Governor DeSantis has done. Maybe you have a question that I can answer that isn't related to your particular healthcare situation. Use hashtag HeyJB in the Facebook Live comment section, and I will try to get to as many comments here as possible. Let's see here from Melody, hashtag HeyJB. Did he mention anyone having adverse effects from any of the vaccinations? He did not, but I want to point out that side effects are common with really just about every vaccine. Side effects are just proof that your body is working. When you administer a vaccine to a body, it's of course common for there to be a reaction. It just means that your immune system is identifying what is currently in your system and reacting as such. So common side effects, injection site pain, like right where, of course, where you get the shot, it's going to be maybe numb, a little bit sore, fatigue, headache, muscle pain, joint pain. Very rarely will there be a mild fever. And also it's more common for you to have side effects with a weaker immune system. So those that are older will probably feel more side effects in the hours or day or so after they receive the vaccine. And those who are younger, those in their 20s, 30s, even in their 40s and 50s, will have less side effects because they have more of a robust immune system. Melody, hopefully that answers your question. We'll take 2 or 3 more here in the Facebook Live comment section. if I see them. I'm not seeing too many other hashtag HAB comments. Let's see here. Laura Montgomery, hashtag HAB. Are they allowing snowbirds to get the vaccine, or are they prioritizing residents? As I understand it, you do not have to be a Florida resident to receive the vaccine here in Florida. And this is really an important distinction, right? Because there are going to be so many seniors that are coming here from other states. And just because you don't live in Florida doesn't mean that you shouldn't be able to get the vaccine here in Florida. Maybe this is your home. And maybe if you spend, let's say you spend 8 months out of the year in New York and 4 months out of the year in Florida, you have a New York driver's license because your primary place of residence is in Florida, that doesn't necessarily mean that you shouldn't be able to get the vaccine. And we're talking about a life or death situation for a lot of people, potentially here in the state of Florida. So as I understand it, there's no prioritization for those who are Florida residents versus non-Florida residents. I could be wrong on that, but that's how I understand it as far as the system. Some kind comments here in the Facebook Live comment section. I really appreciate it. Thank you. And I don't see too many other comments. I think what we're gonna try to do another stream a little bit later on to address some of the other questions that have arisen today, particularly in Hillsborough County with the site crashing this morning and crashing pretty significantly. People not being able to schedule appointments for their COVID-19 vaccination shot. That's of course a problem that needs to get addressed. Because we're just dealing now with vaccination appointments for those 65 and older. Can you imagine when the floodgates open and anybody, let's say anyone in an essential workplace, can get the vaccine? Can you imagine the amount of appointments that are going to burden the infrastructure, the digital infrastructure where you go online, these online portals where you go to make these appointments? It's going to be 10 times worse than this, if not more. So the signs today that the 65 and older crowd have experienced so much issues and so many problems and so many errors with making their appointment is definitely cause for concern here in Hillsborough County, one of the most populated counties here in the state of Florida. So Masa Saidi is working on that story. 8 on Your Side investigator Masa Saidi is working on that story. She'll have more tonight in our evening newscast, and we're going to try to stream a little bit later on with an update and maybe to answer some more questions here for you on Facebook Live on WFLA Now. We'll see here. Lanny McDonald, hashtag AJB. When do folks who are age 67 get to get vaccinated? Now, 67. Older than the age of 65, you should be good to go. Let's see here. Roy Harper, hashtag AJB. Any idea when drugstores or doctor's offices will have the vaccine? This is a really wide-ranging question here, Roy. And as I understand it, it's a process that is going to be rolled out here in the weeks and months ahead. Just like, remember, I want folks to go back to when testing started. Remember when in the spring of 2020, when testing was very, very, it was difficult to get a COVID-19 test at first. It was lines were extremely long. They weren't efficient. It was a troublesome and cumbersome process. And then, of course, now it's much more of an ease for Florida residents. It's going to be very, very similar here with the vaccine. The vaccine is only available to some right now. We're having problems such as the website crashing in Hillsborough County. These are things that are going to get fixed and solved over time. As the saying goes, Rome wasn't built in a day. There's going to be improvements here to the system. It's just going to take an extended period of time, or hopefully not an extended period of time, but a brief period of time for us to get past some of the issues that have plagued us here in Florida, at least initially. And then once we get past some of these issues, we'll be able to get the vaccine without issue here in the state of Florida. Again, a few more comments that are very, very kind. Thank you. I appreciate it. Yeah, Patricia Denham, hashtag HAB. What about Polk? No info yet. And I would think that 65 and over would have been exposed to more over our lives. Just really quickly about Polk. I believe that that the process, we're very, very close to hearing about Polk. Actually, appointments are going to be scheduled the morning of Wednesday, January 6th. That information is on WFLA.com. But yes, Polk County is lagged a little bit behind some of the other counties here in the Tampa Bay area. Folks, I think that's going to do it for me. One more time, your poll results. For those of you who voted, we received about 4,000 votes in our interactive poll asking you to grade Governor DeSantis' handling of the COVID-19 pandemic in Florida. 35% of you saying an A, 6% giving him a B, 7% a C, and then the most popular answer, a majority, 53% giving him an F. Again, grading him over the duration of really the last 10 or so months since the pandemic began here in the United States and here in the state of Florida. WFLA.com and the WFLA app is your hub for everything related to the COVID-19 vaccine. The latest numbers are updated on WFLA.com on a day-to-day basis. Every time we receive a report from the State Department of Health, we publish it and publish its findings on our website. And any new information from the governor's office, from state or local officials, it's all available for you on WFLA.com and the WFLA app. Our very hardworking team here is working around the clock, quite literally, to provide you with the very latest on how you can safely get the vaccine and to what is going on the ground here in the state of Florida. We're going to try to get back up on stream here soon, folks, and answer some more of your questions as those questions begin to, of course, come in. Stick around here on WFLA Now. We'll try to get to the very latest here as it develops here in Florida. Thanks so much. We'll be back.